Welcome to the 2015 series of recordings on HealthOne version 7.5. If you have 7.5, then the following videos will be relevant to you. We're talking now about the pregnancy. This is one of a series of videos on the pregnancy, and we're going to talk today about the options and the configuration of the pregnancy module in version 7.5. As you can see with this patient, she is already pregnant. The pregnancy tab is to the fore, and her current and 7th pregnancy recorded in HealthOne is 31 weeks duration. I'm going to discuss today some of the options available. So we'll click on Tools and Options and go down to Pregnancy and click on Pregnancy. And you can see here you have various options relating to the new pregnancy module. The first one is to enable the pregnancy grid. The pregnancy grid is this grid over here, so it's either enabled or disabled. By default it will be enabled, but if you wanted you could disable it. We don't recommend you do that. Display the pregnancy grid when it is enabled automatically for women over 16 years of age, and you can change this. Auto select the pregnancy tab when the woman is pregnant. In this particular case, the woman is pregnant, so when we opened the file, the pregnancy tab was automatically selected and was on top, was the first one to be seen. So that's what this one means, auto select the pregnancy tab when the woman is pregnant. The next one is to display the pregnancy mediform when creating an obstetrics transaction. What do we mean by that? Normally, with the new module, we would prefer if you entered new pregnancy transactions, consultations, by using this button up here and not using this one as you used to down here. However, if you do use this one and you call it an obstetrics transaction, that's what this option is about. So when you create an obstetric transaction using the old method, we will still display the new pregnancy mediform by default. So I'm going to exit this. I'm going to do a transaction using the old way, call it obstetrics, and say OK. As you can see here, we have the new pregnancy editor coming up, and you can change it to various types of transactions, which we're not going to do today. But if I just cancel that and go back to Tools, Options, Pregnancy, you'll see that that's what this means. Display the pregnancy mediform when creating an obstetric transaction using the old method. Now, however, we will hope that you will always use the new transaction icon on the pregnancy grid to create your pregnancy transactions. This option here is to use a template to print pregnancy documents on untick to use reports. When you're using the new module, we will expect you to click on this button for administrative items such as sending in a maternity application, a maternity referral, and a maternity claim form. This option determines whether you're going to use a HealthOne template as you used to in the past, or use a new type of report. So I'll untick this, which is the default, which means we'll be using a report, a fast report. I click OK on that, and I click on this button here. As you can see, this is the administrative button for the new pregnancy module, and there are 3 print items here: a maternity application, a maternity referral letter to the hospital, and a maternity claim. And each of these uses a report or a template. So there are 3 different forms. They can be either in the form of a fast report or an old template type. In either case, they'll have to be edited, and this will be the subject of a different video. So let's just do maternity application using the report, and here you have an application to the HSE using a report type form. These forms are called fast reports. Also, when you're sending in a maternity application, in either case, HealthOne will ask you, do you want to record the fact that it has been sent, so that we can follow these up. The second one, in the administrative button here, is a referral letter to the hospital. And again, this is using a fast report, a simple referral letter to a hospital. As I said earlier, these reports and templates may have to be edited to suit your own practice, and this will be the subject of a different video. HSE maternity claim in the form of a report, again, that's the maternity claim form. And these are the antenatal visits. In this case, the pregnancy isn't actually over, so we don't have a lot of maternity visits. And these visits are extracted from the new maternity section. And again, you're asked, do you want to record the fact that you sent in the maternity claim form, so that we can chase them up. So let's go back to tools, options, and pregnancy. And here you have your option. Use template to print pregnancy documents unticked to use report. I've just shown you the unticked version. Now I'm going to quickly show you the ticked version, which is a template. Why might you use templates? Well, you're used to using templates, so they are edited in a different way. So if I click on my administrative button and again choose the maternity application, this time HealthOne will choose a template, an old type of template, but again will have to be configured by the doctor. This is the maternity application to the HSE. So we're going to exit that template. We're not going to record the fact that we sent the maternity application in this case. Again, go back to the administrative button and do the referral letter using the template, the HealthOne template form, and here is your referral. It's very similar to the report, it's just that we're giving you the option to use either a template or a report, and this is how you would do it. Again, I'm going to click the administrative button and the HSE maternity claim. And here you have the maternity claim form. And as you can see here, the transactions, the consultations, the maternity consultations are extracted using the new maternity recording method, which means you have to have the transactions linked to the pregnancy in order to extract them. Linking transactions to the last pregnancy is the subject of a different video. I'm going to exit that, and I'm not going to record the fact that we sent in the maternity claim because we're only showing it to you. So I'm going to show you the last option in tools, options, pregnancy. So that was use a template or untick to use a report. So there's 3 templates and 3 reports available that you can edit. The last one is the associated sequence. If you're using the old method of entering maternity consultations, you will normally use either a maternity Mediform or you use a sequence. In this case, we're going to demonstrate the discharge, the baby discharge form. There is no associated sequence to this. Because there's no associated sequence, and we're going to click on the consultations button up here to do a delivery form. So when I click that, a form here is brought up referring to the delivery, and the fields in this are set. So I'm going to say the delivery date was the 12th. I'm going to say the type of delivery was a normal delivery, and then I'm going to put some information in about the baby here. So his forename is Thomas. His sex is male. His weight today is 4.5 kilos. His height is 88 centimeters, and he is breastfeeding. These associated lists are taken from your own associated lists. The fields or the items here are a default set of items that HealthOne will use if there is no sequence attached. So this is the mother examination. As you can see here, she was 79 kilos. The last pregnancy, so now she's lost some weight. We say she's 70 kilos. Her blood pressure is 120 over 76. Menstruation, she has nil. Again, you can just type pretext into any of these as well as use the lists. And I will forget entering about anything else, and I will say mother and baby well, and I click OK. And as you can see here, these are the hard-coded items that HealthOne has put in. However, I'm now going to exit this file, and I'm not going to save any of it because I don't want to. And I'm going to reopen it again, and I'm going to go to Tools, Options, Pregnancy, and for the discharge baby, let's say I'm going to say I do have a sequence in HealthOne for my discharge of my child, and it's this sequence. As you can see, there's more items in this, such as the hospital, postnatal 2-week check, 6-week check in particular. Keep an eye on these. And I'll say OK. So I'm using a sequence. I have a sequence in HealthOne that I'm associating with the discharge of the baby, and I'm clicking OK to this. Now when I do my new examination and call it a delivery, I'm recording the fact that the baby was delivered again. I get the same form. HealthOne can't add your items in your sequence to the form, but it will add them to the consultation at the end when you're finished the form. So I now put in the information in the form. We'd say to the cesarean section, and the first name is Jack. Male, his weight is 4.5 kilos, his length is 87 centimeters, and he's breastfeeding. The mother's exam, and here I could, by the way, at the end of the baby, I could create a new baby file, which HealthOne will then create a new file for you. The mother, in the meantime, is 70 kilos. Her blood pressure is 110 over 78. She hasn't had any periods yet, and I don't write anything into any of these except mother and baby well, and I click OK. And when I do that, as you can see, the other items, such as the hospital, the postnatal 2-week and the postnatal 6-week items which I have in my sequence, are entered by HealthOne. So that is the purpose, and I can fill them in separately, which is actually, that's a calculated item to tell me the date that the patient is due. So I can, through using this Tools, Options, Pregnancy system, I can have my old sequence for any of these visits, and when HealthOne has finished entering the default set of information, it will add any other items you have in your sequence, which is a handy thing to be able to do. And that is the end of this video, showing you the options available to you to configure the new pregnancy module. And it is worth your while spending a little bit of time getting used to these. And that is the end of this video. Thank you very much.